Hello, my name is Isaiah Hernandez. I'm a student PT here at Rocky Mountain, and today we are going to be working with a patient who is 18 years old, 2 weeks post right ACL reconstruction surgery. Patient is having pretty minimal pain, but is having some problems activating the quadricep muscle during therapy and is having some extensor lag with straight leg raises. So today we're going to be using some biphasic pulsed current NMES, some electrical stimulation to try and get that quad refiring again and get it working so that we can really start to strengthen it up. So some things that we want to look for with E-stim, obviously indications would be, as I just stated, having a lack of being able to fire muscles actively, and just having the potential for neurological re-education of muscle firing. Some things we want to avoid when we're using the E-stim today would be patients that don't have fully intact sensation, impaired cognition, cardiac dysfunction, or any sort of diseases or conditions involving epilepsy or seizures. And then some absolute contraindications for this would be obviously pregnancy, active infection, active cancer, any sort of pacemaker or any sort of implanted devices. So with that said, I'll show you how we'll be setting up biphasic NMES, and then we'll show you how we get a muscle contraction. All right, I'm here with Jack. Jack, how are we doing today?
Not too bad.
Doing all right? All right, well, what we're gonna do today is some electrical stimulation on your quad.
Okay.
We've been having a little trouble firing that muscle, so we're gonna use some E-stim pads, and we're gonna use a special setting on our machine to hopefully get that muscle firing, and then hopefully we can get you to kind of fire with the machine,
Okay.
which should overall just kind of get that firing pattern back and just get you to be able to actually actively use that muscle.
Okay.
And we'll be able to strengthen it up from there.
Perfect.
Okay, so we want to make sure we have all the settings correct. So we have it here on biphasic. We're going to be doing 10 seconds on, 50 seconds off, so the patient can have a good rest and be able to really fire that muscle fully and get max strength gains. We're going to ramp the E-stim at 1.5 just so it doesn't come upon the patient too quickly or unexpectedly. This treatment time is going to be 10 minutes today. We've got our pulse rate at 50, which you would want at either 50 to 80 pulses per second, but we'll do 50 today. And then you want your pulse width at least 200 up to 800 microseconds, but today for this machine we'll just be using 200. And then for your amplitude or intensity, we want this all the way up to at least 50%, preferably 60 to 70% of their voluntary contraction, so just them firing the muscle on their own. So whatever that number is, we'll pump it up until he can get at least 50%, if not 60 to 70% of a normal contraction. Okay, so before we get started, we're just going to gently wipe the area that we're going to be treating today. Make sure there's nothing impeding the pads here. And then we're going to want to take our 2 E-stim pads, and we are going to put one kind of more on the top upper third of that quadriceps muscle, and then we will do one kind of in parallel more towards the bottom third of the quads, a little closer to the patella. Okay, we're feeling all right there?
Yep.
Jack? Awesome. All right, and as I've already shown you guys, we have all the settings we want. So now before we actually hit start, we're just going to turn up the intensity. Again, we want anywhere between 50 to 70% of his max voluntary contraction. How are we feeling so far, Jack?
Just started to feel a little.
Feeling it a little bit? Okay. And you always want to be checking in with your patient, making sure they're not in any discomfort or extreme pain with this. So as you bump it up, just checking in ever so often, making sure they're still feeling okay is important, especially if they have not had this modality before. So we're gonna keep pumping it up. We're getting a little closer to 50 here, so hopefully we should start seeing a little bit of muscle activation. How we feeling, Jack?
Good. Getting close.
Getting closer.
Grabbing that thing.
So, all right, you feeling it right there?
Yep.
It's about half of what you would normally contract.
Mm-hmm.
Okay, so while it is on for 10 seconds, I'll have you actively fire that quad. And then we'll take a rest. Perfect. So, as you can see, we'll do that for 10 seconds. So he will get 10 contractions within this time for treatment, which is what you want to aim for, or you can do it as much as you need to, up to an hour. Okay, and we would do this for 10 minutes, 10 seconds on, 50 seconds off. Okay, and we just finished our session. How are you feeling, Jack?
Awesome.
Feeling good?
Experience for sure.
Yeah, really toughed it out there, pushed through, made some gains today. And then before we let him go, we just want to check again, give him a little wipe, and make sure that there are no burn marks or anything else going on with the skin. Everything looks good, so nice work, Jack.
Thank you.